Without wasting any time, let us welcome our honorable panelists for Symposium 5. Yang Berhormat Dr. Maszlee Malik, the former Minister of Education and current Member of Parliament for Simparangam. Yang Berhormat Wong Chen, the Member of Parliament for Subang and Member of the Parliamentary Special Select Committee on Finance and Economy. Mr. Azrul Muhammad Khalib, the Founder and Chief Executive Officer of Galen Center for Health and Social Policy. And please welcome our moderators, Dr. Sharon Kaur, anak perempuan Guru Meksing, a senior lecturer at the Faculty of Law, University of Malaya, and Dr. T. Meng, a senior lecturer at the Faculty of Education, University of Malaya. The title for the symposium is Education and Health in Changing Economy. Now, we would like to pass the floor to them. Please welcome our honorable panelists and moderator.
Thank you so much, Atika, and a really warm welcome to everybody to the last session of the Malaysian Universities Economic Conference 2021. And this session is on education and health in a changing economy. And we're really excited because we have an amazing an amazing panel. And today we're going to discuss the current state and future of the economics, health, education nexus in Malaysia. And we're going to particularly be looking at this in relation to the COVID-19 pandemic. And because we're actually going to cover three different areas that are separate but extremely interrelated, I'm just going to very, very quickly go through the format of our session with everybody, just so that we all know what's going to happen before handing it over to my colleague T, who will start the ball rolling. So the first thing we're going to do is we're going to ask all three speakers one general question to get an overview, like an opening salvo of what they think of this big nexus and how everything comes together. We will then dive deeply into each section, economics, education, and health, and talk a little bit more to each speaker. But we will also allow the other two speakers, the other panelists, to respond at the end. And finally, we will have a Q&A, and we really are looking forward to your exciting questions. And then they will have parting words of wisdom for all of us before we end. So I'm really looking forward to this, and T, over to you.
Thank you, Sharon. So real quick, just to remind our audience, we have YB Wong Chen, Member of Parliament for Subang, YB Dr Maszlee Malik, Member of Parliament for Simpang Renggam in Johor, and also importantly, he was former Minister of Education for a couple of years in the previous administration. And we have Mr. Azrul Muhammad Khalib, who is Chief Executive of the Galen Center for Health and Social Policy. So we're going to hear from these three very distinguished figures, and we will, like Sharon said, we will start with the opening question, which each panelist will have about 3 minutes to kind of give an overview of their thoughts. The question that they are responding to is this: from a policy standpoint, what has the COVID-19 pandemic made you realize about the strengths and weaknesses about the economics, health, education nexus in Malaysia? So it's a triangular question, and we like to get the ball rolling with YB Wong Chen. Would you like to get us started, YB?
Sure. Thank you. Thank you so much for inviting me to join this. My friend Dr. Maszlee, of course, and also Azrul. Let me just get down to it. Okay, the nexus of economics, health, and education is quite clear. I mean, COVID is an obvious threat that has a very, very deep negative impact on the economy. So that's the link between the two. So if you don't deal with the health issue, of course, you're going to have problems with the economy. Lockdowns basically destroy the economy on the side of the services sector, not so much on the manufacturing export sector. So services sector is about 55-60% of the GDP. So every time you have a lockdown, you're going to have an impact, at least a 30% reduction on economic activities on the services sector, right? So for recovery, we really need the public health policy to step up implementation to improve dramatically. And then hopefully the lockdowns will be shorter and less frequent, therefore giving a breather to the economy overall. When you come and look at the third element, which is education, we're really looking more into the future rather than the immediate problem at the moment. We are looking at the economic scarring, and we think that this thing may last 3 years at least. So the key point should be the longer term implications for the students who are affected in this 3-year period. And those will be about a third of the students who are in their absolute crucial years, SPM, university, and that kind of thing. And then we're going to worry that they're going to be stuck there for about 5 years maybe to recover, and this will impact the job market overall. And lastly, just give you the 2 key points that I think is the most important and basic issue to deal with. One is obviously the key witness of the migrant workforce problem. We have a lot of illegals or undocumented ones, and we have the legal ones working in factories which are not, in the best environment for containing COVID. So that one actually impacts a lot, also puts a lot of stress on the health system that we have. Yeah. And then the second key issue is really the fiscal weakness of the government. There's argument whether we have enough money to solve the problem and whether we can do QE or we can pursue other means. But on the flip side, there is an argument that we do have money. It's just that we don't have what we call good spending or the proper spending. So while you may be able to raise the money, which I suspect is quite difficult at the moment, but if you do manage to raise that money, you still have the problem regarding, are you spending on the right things? What are your priorities to get us out of this mess? Okay, those are my first opening lines on this. Thank you.
Thank you so much, YB Wong Chen. I think we go straight to Dr. Maszlee.
Okay.
Go ahead,
Thank
Dr.
you,
Maszlee.
Okay, Dr. T and Dr. Sharon and our respected panelists, Dr. Wong and Azrul. I think when we talk about education, it's rather a mistake to look into education from a very conventional, narrow perspective and approach in which we are seeing it in a mere schooling and teaching process alone. Education, we could summarize it, is all about nation building. It's about capacity building of the citizen, and it's about paving the way for the nation's future. And the most important element of education is that it is an essential element of civilization. I still remember when I presented my speech in the parliament to debate the government's recovery plan for the nation, plan, what they call it, plan pemulihan national, whatever they call it. I felt very upset that education was not given serious attention in the plan. Worse, they failed to ensure a proper ecosystem for nation's recovery from the pandemic. It is a gross mistake to see education to be separated from health, economy, politics, communication, and social issues. I believe that if you want to rebuild the country back from the pandemic, education must be addressed and must be given an utmost priority. Any recovery plan for a nation must always look at education as an integrated process that requires proper collaboration of most government ministries and agencies. This is where my critique always all about. And everybody's working in silos. And when I talk about education, we thought that it's only the responsibility of the Minister of Education alone or Minister of Higher Education alone. It's a bit funny when we have two ministries looking in education, but when we prepare a plan, none of them got involved to present it to us in the House. I think the pandemic has shown us of our unpreparedness before and during the pandemic. We could forgive any government for their unpreparedness before the pandemic because it's very unprecedented. I think that's the case of most countries in the world a couple of months ago. But after more than a year after the pandemic, and we are still stuck at the same point, I'm referring to Malaysian government and where we are now, we're still stuck at the same point without any improvements and without learning from our mistakes. I think that's totally unacceptable. I think the previous UNESCO Ministers of Education meeting in March has shown how a lot of other countries learn from their mistakes, experiments and lessons since a year ago. Hence, they are reinventing themselves, reinventing their approach to education. They share their experience on how they keep improving themselves and continuously reinventing suitable approaches to education after a year of the pandemic. It's very unfortunate Malaysia was not there, and if Malaysia was there, they have nothing to share with the other countries of the world. And I think in any approach that we want to use, we must know that there are 5 major fundamentals that we need to adhere to. Number 1, access to quality education to all citizens without any discrimination. Hence the mantra that I always say, education for all, pendidikan untuk semua. And number 2, education is everybody's responsibilities and rights. It's not only the responsibility of MOE and MOHE, it's everybody's responsibility. Number 3, health and safety as priorities. In whatever we are planning for our education, we must put in our mind that health and safety is part of the priority. And number 4, there's no one silver bullet to solve the issues of education during the pandemic. Hence, we should mutually learning from each other and always try to come up with better approaches. I mean, it's not a shame to learn from others and to share our experience with others as well. And the 5th one, this is the most important one. Education should not be seen as, the rotting the curriculum at school within the 4 walls of the classroom alone. Education should be viewed as a holistic process in developing individuals' humanistic values and inner potential. So what we need now in planning ahead, the exit plan for education amid the pandemic and after the pandemic, we need a comprehensive collaboration among ministries, among agencies and stakeholders in this tough time and aftermath. Like I always say, and I always say it, education is for all and everybody's responsibility. Thank you, Dr. T.
Thank you so much, Dr. Maszlee. So we're beginning to hear an emerging theme, right? The need for a more comprehensive, more integrated response and a more holistic response. So hopefully, as the panelists prepare to share their points of view later on, we'll get to hear a little bit more details of how this comprehensive integrated response can come into play within this country. So now we're transition to Encik Azrul. Are you ready to give your 3-4 minute response to the primary question? Please go ahead.
Thank you, Dr. T. Firstly, let me just express my thanks to the organizers for having myself on this panel. But I do want to just mention, and it is my custom to apologize for being on an all-male panel, that this is a panel and we should have women representation on an important discussion such as this. So I do apologize for being on this panel that is all male. Hopefully it'll change in the future. Let me just go to the response to the question here. And it is important for us, to remember that Malaysia actually, when we went into the COVID-19 crisis, we actually went in from a position of strength. Malaysia actually ranked 3rd in Asia and 18th among 195 other countries in terms of the overall readiness in facing a disease outbreak. And this was something that was ranked under the Global Health Security Index, which is an index that is put together by the Economist Intelligence Unit, the Johns Hopkins Center for Health Security, and the Nuclear Threat Initiative. So Malaysia, because of our experience dealing with H1N1, SARS, MERS, and many other different, and even Nipah virus, we've had a lot of experience dealing with communicable diseases. But today, we are where we are today, with among the countries with the highest number of daily cases, a large number of people dying as a result of COVID complications, and so many people being brought in death on top of so many other socioeconomic consequences that are due to many of the health measures that have been put into place to curb COVID-19. So, we have been asking the question, what went wrong? What did we do that was not in keeping with what we should have done? We look at other countries that seem to be doing better, and yet Malaysia, which have so much experience in terms of communicable diseases, we seem to not be able to do right, even though it did seem like we were doing all right last year, but today it's far from that. So it's important for us to look at many of the issues today that have come up as a result of a public health emergency, to re-emphasize the fact that health does not exist in a vacuum. And I think Dr. Maszlee and Wong Chen just now talked about different aspects that today COVID-19 impacts. They don't exist in silos, it's not in a vacuum, and definitely has major implications for every part of society. And I just want to in response to this question, just mention 3 points really, so that we can carry on the conversation further, is that first of all, when we look at how the health system has responded, we see the consequences of us not emphasizing enough or investing in things like health literacy. When we had the Malaysian Health Mobility Survey last year released, it was revealed that Malaysians have a generally low level health literacy. More than 30% of Malaysians are unable to even utilize the information that's provided to them on health to take on preventive health measures. So you're trying to get them to change behavior. They don't understand what that information is telling them to do or how they can change behavior. Health literacy levels are also being amplified and emphasized when we see problems in terms of missteps concerning things like vaccine hesitancy, policy missteps. We look at our policymakers, parliamentarians, they're talking about stuff in Parliament, and it seems that they do not understand themselves what exactly the health issues that they're debating about. Recently we heard ivermectin being brought up, which is something, we were like, oh my God, slapping our heads on foreheads and wondering, why is this being brought up? And this is a result of health literacy being irregular amongst even policymakers themselves, and even concepts like lockdowns that have been put into place. You realize that even the government at the highest levels of policymaking don't realize that lockdowns are meant to be temporary measures intended to flatten the curve. But what does that mean? Basically, to give breathing space to our healthcare system to be able to recover from a surge of cases, and instead being used today, as we can see with MCO 2, 3, instead being a tool to try to bring it down to zero, basically, and which is doing immense harm to the different socio-economic sectors that the overall well-being and safety of the people of Malaysia depend on. And we are basically trying to address the disease, but we're attacking people. And that's how even us, we work in the health sector, we see. And of course, the other point that I just wanted to mention is the consequences of not investing or emphasizing on health. And this goes to the political sphere as well. And it's quite odd for us to sometimes talk about it, because health at the end of the day is the third largest budget item on the federal budget. But it rarely gets debated or discussed about usually, except for last year. Last year it was a great debate during the budget debate. And that should be the kind of debates that we should have. But we feel that when we look at it, it's not a political issue before this. Before this, we took it for granted that health was running smoothly. We thought it was running smoothly. Everything was hunky-dory. People paid 1 ringgit or 5 ringgit to get service at the government outpatient or specialist clinics. And we thought everything was all right with the health system. But the reality is that people working in the health space all realize the underlying problems, that the cracks that have formed, and the most problematic aspects of resources that we were supposed to address haven't been addressed and have come to the fore as a result of COVID-19. So we've taken a lot for granted. There's been a culture of complacency even amongst the health sector themselves concerning health in Malaysia, and certainly when it comes to the members of the public, they view it too. And today, unfortunately, with COVID-19, these issues are coming to the fore. It's coming at a very inopportune moment, and it's causing a lot of misery as a result. So I just want to stop there, and happy to carry the conversation forward.
Thank you so much, Azrul. The education and the health budget is 2 of the 3 largest allocation in our national budget. So this economic, health, and education nexus is a very, very powerful and significant one for the country to recover from what we are going through right now. So, without wasting any more time, let's get into the details of it. With regards to the opening salvo from each of the panelists, we have asked a little bit more specific questions for each panelist to respond. YB Wong Chen will get us started, and we have basically asked him to respond to 3 basic questions. The first one is, from an economic policy standpoint, what must be done to lay the groundwork for the nation's recovery from the consequences of the pandemic? The second question is this: what are your thoughts on the gig economy? And perhaps a larger concern is, what is the future prospects for full-time employment for young graduates in the near future as we, as a country, learn to recover from the pandemic? And then finally, if YB Wong Chen has the time, if he could spend a little bit of time talking about the Pemulih program and whether that's really going to help the country. The Pemulih program being the Package Perlindungan Rakyat dan Pemulihan Ekonomi. So those were the 3 questions that we set before YB Wong, and we're hoping that you'll get into the details of the matter. YB Wong, are you ready?
Yeah, I am. Okay, so
right.
Let me address the very first one, and I'll try to keep it short so that there's enough time for everybody to answer questions and ask us more questions, okay? So the first one is on the economy. The most important thing before you talk about recovery is to at least try to maintain or contain the damage to the economy first, right? And the single most important thing when you talk about economics, in terms of macroeconomics, that we have to worry about policy-wise, is jobs. We have to make sure unemployment is contained at 5%, which is what the rate is. We haven't seen the latest numbers, but I suspect it might have inched up to about 6%. But we have to try to maintain it below 8% by end of the year, depending how bad this thing unfolds or how bad the variant is. Yeah. So the very first thing for that has to be wage subsidy. So wage subsidy has to increase a lot more. They spent 16 billion last year. This year they have to spend double that. I would say at least 30 billion, because essentially last year we had the lockdown for a month and it was quite strict. Now we're already into the 2 months plus of the lockdown, and it's a bit loose, and we're facing a different variant, and I'm sure Azrul will explain to you this variant is much more dangerous. So by the same token, using a very simple proportional standard, you have to spend more on wage subsidy, less so on the Prihatin packages or handouts, because handouts you should target, but if you cannot stop companies from folding, then you're going to create an unemployment problem that will snowball into a domestic consumption problem as well. Yeah. So to me, protect the jobs, hold it there, and then we can talk about recovery, say a year from now or half a year from now, when we get full immunity or herd immunity and we don't face any other different variants out there. Yeah. So I'm more optimistic in the sense that I think in the first quarter next year, we should be able to go and see some real positive trajectory for growth again. But then you have to start that growth period with 6% unemployment, not 12%, 10% or 8%. So do that first, hold the ground, because most companies out there have, when their sales are low, right? And most sales are low for the last 2 months. They only have cash flow for about, at best, 6 months, at most 3 to 4 months. So you can imagine if this lockdown continues at this pace, then we will see companies starting to fold as early as September. Yeah. So to me, that's the most important. Wage subsidy, get in there and you try to hold it. Okay. Now, the other thing is, of course, whether a lockdown happens or not, you need to move from the essential to non-essential to one which is based on risk and which is low risk or high risk. Yeah. Because after 2 months of lockdown, your non-essential has become essential. There's no difference anymore. So you really have to move on to the risk-based system. Therefore, you need to then build the ecosystem to quickly do testing, mass testing, and you need to improve your data, the big data, a lot more. You need to pump in a few 100 million, get real data scientists to come in. Then you can have, immediate testings and mass testing, sectorial testing, and then you build a database to say, okay, We have this problem, but certain parts of the economy can open, certain regions can open. If you don't have that map or that data available, you're just going to be in the dark, right? So recovery needs data. It needs to protect jobs first and foremost. Okay, when it comes to the issue about finance and fiscal stability, financial stability, our banks are reasonably well off. Yeah, they're doing reasonably well. Even the issue about moratorium, whether we need more moratorium or not, that is really up to Bank Negara to tell us. We as members of parliament can guess, but Bank Negara really needs to report to us. So we need financial transparency and periodic reporting on those issues. But my gut feel, and talking to a lot of people out there who are in business, there is no so-called moratorium crunch that we need to pursue at the moment, other than in the retail, when you buy a car, buy a motorbike, and you're financing those things do require some moratorium interference, especially for the low-income people. Yeah. Now, the big issue, as I raised at the very start, is the issue of fiscal government revenue. We know government revenue must be down. It is a given, right? It's a bit sad that we've not had parliament for 6 months now, 7 months now, right? And no answers have been coming forward regarding the financial revenue status of the government. And that creates a big problem, because without money to pump into this kind of programs, whether it's wage subsidy, Prihatin, or whatever you want, then it's not going to work. You can plan all you want, but you need to solve your financial situation first. So the government has been issuing a lot of bonds. I've been tracking a bit. I think it's about at least 70 billion has been issued this year, but they have 60 billion to repay or to roll over within the next 3 months or so. So in actual fact, if we calculate based on the government's fiscal projection, their budget, they want to spend 70 billion on development expenditure this year, which I think is crazy, because you cannot spend on infrastructure now, because you're going to face perpetual, periodic lockdowns, right? And there's no clear indication how much they want to spend on the COVID matter. They had to raise 5 billion from Kwan to pay for vaccine. I mean, that's nonsensical. You got a government budget of 70 billion for development projects for all their friends and cronies, or whatever you want to call them, right? But they haven't allocated enough for COVID itself. So on my calculation, they need to raise about 100 to 120 billion of MGS or Sukuk this year alone. Again, we're guessing. So it will be very important that Parliament sits more frequently. We're going to be sitting in September. But the finance minister needs to tell us the situation, and then we got to consider other means. Do we need to do QE like Indonesia and also Philippines, limited QE, quantitative easing? Do we need to increase the Bank Negara ceiling to buy above 10% of MGS? Do we need to increase the ceiling for foreigners to buy Malaysian government securities? Because foreigners are interested in buying Malaysian government securities. It's just that we allow them to buy a lot, then we could face problems. If they decide to dump the bonds, then we could face the problems that we faced in 1997. So all these are key policy issues that the government need to disclose to us. We in the opposition just, at best we can guess, do the best guesstimate, right? Once you come clean on this, then we can unite as a country and say, look, okay, we can only raise 50 billion. We can raise 100 billion. Then we should sit down and prioritize what should we prioritize spending, because this is the problem in Malaysia, is the moral hazard. You can raise money, but you spend money on stupid things. 5G is a completely stupid program to do at this moment, right? It's got nothing to help the COVID battle. When companies are facing closure, they're thinking about awarding mega projects. This is not the way to do it. So that's why, when I talk to some economists and I say, look, we need to raise money, then they say, okay, we can raise 50 billion, but what are you going to spend it on? Surely you must prioritize COVID. You must prioritize, wage subsidy. You must prioritize people who are flying the white flags. I mean, they're starving, right? So that's the two dynamic issue that we have to look at: money, and then work out how to spend that money in terms of economic growth. Okay. Now, can I move on to the second question? Because otherwise this will take a bit too long. I can go on forever. But on the gig economy, my position is quite clear. The gig economy has a positive impact at the moment, because it is creating a lot of jobs. Whether the big problem is whether these jobs should be long-term, medium-term, or short-term. The word gig itself means it should be short-term, and it shouldn't be a 10-hour work job day. It should be, when you are like doing some work and then you're say your housewife or a house person, right? And you have a 4-hour break, you can drive around and do some gig. That's the whole purpose of the gig economy. When you have people working 10, 12 hours on the gig economy and they're on contractual basis, it raises issue about labor rights. It raises issues about their capacity to improve themselves. So if they are fresh graduate at 23 with a degree in something and you can't get any job out there, you end up working in the gig economy for 10 years, you basically destroyed your future prospect. And it cost the Malaysian government, University Malaya is a public university. The government pays 80% of the cost of education, right? It's an investment by the government to educate these people, and we want them to be long-term, becoming an engineer, accountant, rather than be a gig driver. So to me, the gig economy is a temporary solution, but in the longer term, it is bad for public policy, because it steps into issues about labor rights, about everything else, and also about the capacity and future capabilities of these people are stunted, right? I always look at the Nordic model. I think Norway is saying that they're looking at anywhere below 10% to contain it, the gig economy to be about 10% of the labor force. And they are a highly developed country with a lot of workers have spare time to do things, So I think we need to tweak those issues. And then the third one, if I can't remember, what's your third question? Can you just tell me, refresh the question to me?
The third question is about Pemulih program.
Pemulihan. Okay. Yep. Yeah, Pemulihan. Okay, so I think some of you know that I actually met the Tunku Zafro on the 14th of July, and I presented 40 points to him. I was asked by the party to share PKR's position on the national recovery. To me, we talked about a lot of things like health. I'm sure Azrul can answer better than that, and we talked a bit about the education side, and Maszlee can deal with that. I was primarily concerned about the financial status of government and the fiscal position, and the economy overall. So I've already answered those at the front. The key point I want to do before I give the rest of the panelists a chance to speak and answer their question is that are they serious? Are they going to meet me halfway? That's the key issue. I was very frank with them. I just told them whatever I believe to be the way forward, the roadmap, and they were furiously taking notes. And 2 hours later, I got a call from another minister whose civil servant sat in the meeting and told me that he wanted to meet me. So I think they gave us the time and space, and I think they appreciate what we've done. But having said that, that appreciation, is it converting into some sort of policy, right? I'm not sure. And to be fair to Tunku Zafro, he's a senator. He has no political power whatsoever. So making him the chair of or coordinating minister, I think that's the actual word, of the national recovery thing, is he needs political push lah. So whatever proposal you make, they may not like it, right? They may like to give more money handouts because it makes them look like they're better rather than trying to save the economy through the wage subsidy. I don't know. It's really hard to gauge. And by the last few days, the actions in Parliament this last week, I don't think there's a political will to meet us halfway. In fact, it is all politics now. It's just how to stay in power at all costs. And that's the sad thing, because both sides, I think, have policy ideas to give, but no, they don't have the political will to accept our policy, and that their main focus is really about political survival. Yeah. Okay. So thank you so much. I better hand over to the rest. Thank you.
Yeah.
Thank you so much, YB Wong Chen. A real quick summary, right? So we have been talking about education, economics, and health. Now there's this giant in the room, the political side too, that's coming in to play a role. So YB Wong talked about protecting jobs, making sure we are making decisions based on good data, making sure that if you're going to have spending, we are spending on the right things that will help the economy grow out of this. And also to look at things like gig economy as what it is. It's a temporary, short-term thing. It shouldn't be the biggest solution for fresh grads to look at. So those are some of the key takeaways that I hear. Sharon, go ahead.
Yeah, so thanks. So now we'd like to invite Azrul and Dr. Maszlee to respond if you like. So maybe Azrul, if you'd like to go first, and then Dr. Maszlee.
You mean respond to what Wong Chen
yes,
said? Or?
If you have any specific responses to what Wong Chen has said.
Oh, I'm good. I'll
Okay.
pass it over to Dr. Maszlee, I'm sure, because of time. So I'll pass it over to Dr. Maszlee.
Dr. Maszlee, you're muted. Dr. Maszlee, you're muted. Stop.
Am I? Okay, now I'm here.
Yes.
No, I think we better stick to our own niche to save the time, because I think the time is running and it's not on our side.
Okay, so we'll just go straight into the next section, which is education. T, would you like to carry on?
Sure. We'll get transition to Dr. Maszlee here. So he knows the questions, but I want to share these questions with the audience so that you know what he's responding to. The first question is about this matter. What are some of the most profound systemic weaknesses of Malaysia's education system, which has been exposed or magnified by the pandemic? And along those questions, what must be done immediately and in the long term to address these weaknesses? The second question is this. Even before the pandemic, there was a large disparity between the resources and educational assistance available to different income groups and different areas of the country. During this pandemic, this disparity has become a lot more apparent. What is your opinion on what be the after effects of the pandemic in this regard, and how can we reduce this gap? And then the final question is this. A survey by the Merdeka Center found that more than 2/3 of youth have no interest in getting involved in politics or even any form of participation in politics. However, young politicians are very much needed to inject new ideas for the development of the country. What are your thoughts on this issue, and in your opinion, what can be done to increase youth participation in politics? Dr. Maszlee?
Okay, thank you, Dr. T. Just like I mentioned in my opening remarks, the pandemic has shown us of our unpreparedness before and during the pandemic. We have our traditional problem. Everybody is working in silos, and the very big picture of education has not been taken seriously by everybody. So they thought when it comes to education, it's only the responsibility of the Minister of Education, or now we have two ministries, the Minister of Higher Education as well. But just like I always said and I mentioned just now, what we really need now is a comprehensive collaboration among ministries, agencies, and stakeholders when it comes to education during the pandemic and after the pandemic. I still remember in my speech in the House, I did propose the idea of Majlis Tindakan Pendidikan Kebangsaan, which is similar to Majlis Tindakan Ekonomi Kebangsaan, which gathers all the experts, educationists, professionals, people from the industry, and those from the health sector as well, and other stakeholders from NGOs, from other pressure groups. And this Majlis Tindakan Pendidikan Kebangsaan is responsible to come up with medium and long-term plan for education amid and post the pandemic. The ministry alone cannot do that. I mean, it's very strange when I keep talking about this. It has been more than a year, but the ministry has this attitude of jadong, like been coined by the late Professor Syed Hussein Alatas. Jadong is arrogant and stupid, ignorant. They don't want to listen to others. They thought that they are super perfect, and not even NUTP, a union of teachers, been roped in coming up with a lot of decisions. What more about policies? In the meantime, there should be comprehensive collaboration and arrangement between MOE and Ministry of Communication. You talk about internet connectivity, you talk about online learning and whatnot. They should be in. And I still remember, I did mention about the meeting of ministers of education that had been organized by UNESCO on the 29th March. I think most of the countries in the world are using blended learning, blended approach to learning. They're trying to turn it into hybrid approach to learning instead of only going online. They're making full use of their terrestrial TV, satellite TV, and radio stations as well. And we're not doing that at all. And we always proud of our PDPR, despite the fact that more than 50% of student populations are not having good internet connectivity, and most of them, I think nearly 80% of them, are not having a proper device for learning. So we never learn from our mistakes, we never learn our weaknesses, and we never try to improve ourselves. That's very sad. Okay, and also when we talk about education, I think there should be a proper coordination between MOE and other agencies like JACOA, local authorities, KPWKM, Women and Family for the OKUs, and FELDA, KPKT, and I mean they should come in to formulate a better policies and approach to education to make sure nobody left behind. We don't want any anak orang asli to be left behind just because they don't have good internet connectivity, or they don't have internet connectivity at all, and they don't have proper devices, but at the same time the schools are closed. So the blanket approach by Putrajaya to be imposed to every corner of the country is outdated. They should move on from that. I mean, they should empower the schools, they should empower the PPD with certain autonomy to come up with their own decisions. For example, if they are sekolah kurang murid, if they are located in rural areas, in Pulau Bumbung, Pulau Mabul, in Baram, in Barrio, or Orang Asli, they have less teachers and they are situated in green zone. Why should we prohibit the schools from be open, from open? And the worst part, not only we deprive them from going to school, we also deprive them from getting education because they don't have good internet connectivity. So, I mean, blanket decision by Putrajaya should be avoided in this time of time. I suppose that the same goes with the higher education. This is where I strongly pushing for the Higher Education Council according to the Act 1996. And actually, we have started that in 2019, towards the end of 2019. But God knows what happened to it now, and the rest is history. Okay, should we have that? So we have a less political interference, and we should give autonomy to our higher education, and they know best about themselves. And question number 2 is about disparity. I'm sure that a lot of you are aware about the issue of lost generation. It's a real issue and it's a big issue. It's very unfortunate, never been addressed by our Ministry of Education nor the Ministry of Higher Education, and never been addressed by our government. And I keep asking them in the house, outside the house, in the media, in the social media, please show to us their plan, because it is a real issue and it's a real concern of a lot of international agencies. You just name it, World Bank, UNDP, UNESCO, and OECD. I mean, people are worried about it. So it's very unfortunate. Our government has no clue what they are doing and has presented us nothing on it. And so I tried with all the limitation to do some things through few NGOs and different groups, but still limited. I mean, lost generation is a real issue. What awaits us from it is a huge disparity in the future between those who have and those who have not, between those in the cities and towns and urban areas and those in the rural and villages, and between those who are digitally literate and those who are not. But the question is, how can we reduce the gap? I think we must first acknowledge that that is the real issue. I mean, government need to acknowledge that lost generation is a real issue. Hence, they need to deal with it seriously. But unfortunately, it was never been part of the plan pemulihan. And I think the way forward is to get everybody on the board to come up with solutions. A few weeks ago, I've read a proposal by Khazanah Research Institute. They managed to came up with their own solution. Just imagine if Khazanah Research Institute could come up with a solution, I'm sure everybody else, among the stakeholders, among the industry players as well, they can come up with a lot of great solutions. I think we must also put education as our main priority in our media and flood our media with educational content, which it is not the case at the moment. And give autonomy to schools and to come up with their own plan to overcome this problem. It should be built at a micro level. You cannot use certain formula developed in Putrajaya to be implemented by sekolah orang asli in Tanah Merah, for example, or in Cameron Island. You cannot formulate certain formulation in Putrajaya and try to impose it in those in Pulau Bumbung, Pulau Mabul, and you just name them. I think there's no other way to overcome the future expected disparity issue except with a proper corrective plan and substantial intervention through unconventional means. You know, this unprecedented situation we have requires a lot, bravery and courageousness from the government to come up with unconventional approach to and solutions. And I think the same applied to higher education. We need to work closely with those in the industry. I still remember a couple of, if not months, weeks ago, German Malaysia German Chamber of Commerce came out with their complaint to the government. I still remember during our time, we are communicating not only with them, but also with other EU, American Chamber of Commerce for our higher education and for our pendidikan dasar, our education. Why? Because we want to know what are the job prospects in the next 5 to 10 years. Hence, the mapping of our education towards that. You know, there's no use if you're trying to come up with a lot of reforms without any forecast from the industry. They know the best about what's going to happen in the job industry in the next 5 to 10 years. The same thing, I mean, TVET should be brought back to the mainstream. At the moment, we heard nothing about TVET education. It's very unfortunate. And the final question about political participation among youth, and youth have least interest in politics. I think not interested to join politics or to participate in politics is rather normal. It's not everybody wanting to become politicians like YB Wong Chen or like myself, but not to bother about their duty as good citizen is not a normal thing. That's very detrimental for any developed countries. As a good citizen, I think one must ensure that the country is on the right track. Hence, it requires citizen participation in certain activities that is categorized as political activities. I think this is where, I mean, with our limitation and with the short of time, then we have tried to revive the civic education across the curriculum, co-curriculum and extracurriculum that had been launched in June 2019. Again, I don't know what happened to it now, like most of the cases. But then we had several engagements. I still remember, in order to create that kind of democratic and civilized citizens through the civic education, I mean, we had several engagements with few agencies and NGOs like SPRM, who was then led by our honorable speaker now. I went to his office, he came to mine. I mean, we work closely with SPR, with SUAKAM, with women NGOs, environmental NGOs, with central bank in order to teach financial literacy. And we work along with other ministries like MOSTI, Transport, and others to make sure that all those elements needed to be taught to the kids to become good civilized citizens, to be part of their educational process inside school and outside schooling hours through the media. But time that had been given to us was very limited, and we were kicked out from Putrajaya then, and the rest is history. I said, remember, we also agreed to allow SPRM, Academy SPRM, to come to our school to educate our students on democracy, its process, and even to have a mock election to be conducted for the purpose of learning and educating them. We also decided to allow high school students to have their own election at schools to elect their head boy and representatives then. I'm not sure what happened to them. And, you know, I still remember the most monumental thing that I really keep it inside my heart is we introduced speaker corners. Not only we revive it back at the universities, but also at all schools since year 1 to Form 5, Sekolah Rendah and Sekolah Menengah, right? We revived the speakers corners in universities, and we declared universities as an open intellectual zone for people to come.
Oh, Dr. Maszlee, you've accidentally muted yourself again.
Oh, sorry. Okay, never mind. Where did I stop there? Okay, so in university, we also declared universities as intellectual, open intellectual zone, and we revived student unions in university. And congratulations to UM. You had your student unions. IIUM has their own student unions, but then it stopped somewhere with the new government. And we were on our way to replace AUKU with a more comprehensive law that guarantee the freedom of academy. And that was supposed to happen in 2022, but again, God knows what happened then. But what we have achieved, we have started by repealing certain clauses in the Act to allow students to participate in politics and to have their political activities in their respected campuses. And coming to your question on how to increase youth participations on politics, first and foremost, you must have a government who is sincere in upholding democracy first, and a government that are ready, that are willing to avoid any repressive action against any form of political activities that won't harm others. From there, like I mentioned earlier, education shouldn't be confined within the four walls of the classrooms. Political awareness and civic awareness, importantly, should be taught well throughout the media. But again, you must have a very sincere government to implement that. With the current government, I don't think it will be crystallized. I'm sorry to taking a lot of time. Thank you.
Thank you so much, Dr. Maszlee, for your, tremendous viewpoints and this very holistic view towards education and such important ideas. And hopefully we will get there slowly. So now, without wasting too much time, we're going to put the focus on health. And health has obviously been one of our main concerns over the last 2 years with COVID. So Azrul, you're in the hot seat now. And, one of our first questions, I think you've actually pretty much answered, or you've highlighted some of the main areas which you see as being important in terms of health, that being addressing health literacy, policymakers themselves being literate and using appropriate public health tools in the right way, as well as investing in health. So if you would want to expand or talk a little bit more on what you think are some of the most profound weaknesses or things that we need to address, and what you think should be done immediately and in the long term to address these. And I would imagine this would also include the notion of vaccine hesitancy, because you were talking about health literacy. How do we address that? And the last thing, if you would mind speaking on this, and it's actually appeared on our questions in Slido, people are very, very interested, concerned, and want to know more about this whole issue of contract doctors and the recent hartal by the contract doctors. What do you think about the situation, and what do you think needs to be done to address this matter meaningfully? So over to you.
Well, thank you, Sharon. First of all, where do we even begin? This is not a new issue. This is a decades-old issue. And one of the things that we are very excited with the formation of the Parliamentary Select Committee on Health, Science and Innovation is that not just dealing with COVID-19 itself, but we also get to discuss in public, well, close enough, with regards to the select committee, some of the health reforms that need to be done, and I'm going to talk a little bit on I think 3 points for this first question. First of all, talking about health reform. And if you look at the 2019 Auditor General's report, it encapsulates everything you need to know what is wrong with Malaysia's healthcare system before COVID-19. And it was said, this is quite famous, everybody's heard it already. First, we're underfunded, understaffed, underpaid, overworked, overstretched. This is what the Auditor General's report said, and it was later seized on by the Director General of Health and made very, very public in terms of emphasizing why we need to invest more in health. And the reality here is that our investment in health has not been keeping up with the fact that Malaysia is not a lower income country. We are an upper middle income country that's about to transition into high income company, and it comes with all the baggage of a high income country as it is. Today we have an increase in life expectancy. We have an increase in number of people living with non-communicable diseases like diabetes, hypertension, cardiovascular disease, cancer. We have an aging population, that is growing. The more that we have in terms of life expectancy, the more that we see there being an aged population. And the reality is that we have known this for at least 40 years. This conversation has been 40 years long. We've had more than a dozen studies put together to make the kind of recommendations that's necessary for reform to be done. And the latest that was done was a couple of years ago by the Harvard University School of Public Health, which actually made recommendations to Malaysia, and it comes in 2 parts. One part is public, the other part is classified. Until today, we don't know what is said in that second part. But what we do know is that the problem right now in terms of putting together some of the reforms that's necessary is because there is a lack of political will. This is a failure of successive governments. It's not just this government, it's also the governments before that have not been able to grasp the urgent need to put in the political will and invest in health for the future. We are needing to future-proof the healthcare system, not just to deal with the problems of today, but also the problems of tomorrow, and we just couldn't get there. If you imagine the system that we have now for financing health, the Ringgit Malaysia 1 ringgit and Ringgit Malaysia 5 ringgit, dates back to 1984 is when that system was first introduced, and we're still maintaining it today. And we are very proud that we have a healthcare system that is universal healthcare coverage. It is providing affordable healthcare, but the reality is in the back room, people are struggling to find a way to continue to make this sustainable, and that needs to be addressed. Dr. Maszlee spoke extensively about the siloed problem in education ministry, and this exists in health as well. What nobody has really spoken about is the fact that the Ministry of Higher Education or Ministry of Education, depending on which government came in, which version of it, actually has university hospitals, and they are a vital component of Malaysia's COVID-19 response. Yet in the budget that was passed last year, we saw reductions. In fact, just a slight minute increase perhaps for I think UMMC, University Malaya's Medical Center, in terms of budget. And these are the university hospitals that in places like Kubang Krian in Kelantan, for example, are depended on by the community to provide healthcare. Yet people forget that health is more than just Ministry of Health. It's also Ministry of Education. They don't give the kind of resources there. So siloed approach today is harming, because just like education, and economics, and we see these issues as if belonging to one particular ministry. So you don't want to touch that already because that's the ministry's problem and they should be able to deal with it. So that is the second point concerning the need to deal with the siloed approach. The third is the problem that we have right now, which predates COVID-19, and we don't know what will happen after this with this government or the next government or post-COVID-19, is decisions were made based on how much money do we have. And when it comes to health, it's a real problem if you do that, because you are shortchanging yourself, because rather than look at what you need, you are basing your investment in health based on what we have and not being able to address that gap. So you don't want to address the gap. Instead, you just curtail treatment based on what we can afford. And the results are pretty stark. I give you an example. This is in terms of data, our health outcomes, even though health is the third largest budget item on the federal budget, and that we underinvest, but it's still a lot of money, right? Our health outcomes are poor and inconsistent. And one example is a good one, which is breast cancer. Malaysia, in terms of breast cancer survival, is one of the worst in Asia Pacific. And it shouldn't be the case. But the reality is that decisions are made on terms of treatment based on what medication can we afford. We have to go for generics. We can't afford the ones that are much more effective, perhaps, based on basically what the budget is for the drug budget. So there is a problem there in terms of the need for us to address some of those reforms. And we're hoping that it's not just about increasing the funding, it's also increasing how we understand the money should be spent and to improve on that. So the second question is just concerning vaccine hesitancy. And you did mention just now, and I did talk about health literacy being a problem here, but vaccine hesitancy is natural. If you look at even our members of parliament, apparently there are people who are hesitant too amongst our members of parliament, who do not want to be vaccinated or perhaps are hesitant because they're not sure. And this is really conservatism. Vaccines are produced after a 2-year period of research, trial and so forth, and this, we're very fortunate with COVID-19. Within the space of a few months, based on decades worth of research, we were able to have vaccines that are available today and work. And for that reason, people are quite hesitant to have these vaccines in their bodies, not just for themselves, but also for their family, because they're not sure whether or not it works. But the reality here is that vaccines have been proven to work. It has been able to prevent serious disease and prevent deaths. So it needs to be emphasized to people. And this is where it's health literacy becomes an obstacle, because health literacy is a huge obstacle for people to overcome. You can tell them until the cows come home about the facts and figures concerning vaccines, but if they don't understand the basics of health, it's hard for them to understand the stuff that you're telling them about vaccines. So I don't blame people. It just makes the job of the government harder, because we didn't invest enough before this crisis, and now we're trying to do something that takes decades to achieve within the space of a few months. So that is concerning vaccination. The third final question here is concerning contract doctors. This is really a complex issue. If we were to look at the problems faced by contract doctors and we put them into the private sector space, and see how we would respond, chances are the employer could come under serious legal repercussions as a result of the treatment that's meted out to the people that are under their contracts. And this is where there is injustice, yes, but also the reality here that we have, okay, it's going to be strange for me to say this, is that the reality is that we have too many medical graduates. And one of the reasons this has emerged is because previous governments have been very liberal in terms of approving new medical schools, which have resulted in, I think this time, 34 medical schools in Malaysia or some other, and this is problematic because it's far more than we actually need for Malaysia. And result, because there are only 7,000 spaces for housemanship, for example, in Malaysian hospitals, then you have a surplus of individuals that can take up those spaces and therefore become contract doctors. And then you've got to wonder, how long are you going to have these contract doctors on for? Because every contract doctor has a price tag over them. And to make them permanent means absorbing them into the service, meaning that we would actually have to pay for them. And until today, nobody has been able to tell me how much does one contract doctor conversion from contract to permanent would cost. And the government actually budgets 1.9 billion in the federal budget to address the issue of contracts for not just doctors, but also dentists, pharmacists, and so forth. So we need to be able to look at this fairly. I think we need to make sure that contract doctors get a fair deal. I don't agree with 8 years worth of extension. I think we need also a permanent approach to how we address this issue, but also take the time to listen to contract doctors in terms of what their problems are, because right now there's a gag order, there are threats that are being used, and I think this is totally not on law. These are human resource problems, and we need to address them in a manner that is befitting a human resource approach. And so I think in terms of contract doctors, there is a way forward here, but I have to say here very clearly, the solution, whatever it may be, is not going to satisfy everyone. It's not going to make everyone happy. It may be a solution that will make everybody sour-faced and grumpy at the end of the day, but it could be the approach that will be the way forward. So, we're not going to see all of the contract doctors absorbed into the permanent service, but definitely a portion of them might. So I think that deals with the 3 questions. Happy to carry on.
Thank you. That was amazing. And I think your last response really encapsulated this really deep and meaningful relationship between education, economics, health in terms of the contract doctors. It's not just about how much you're paying them. And it really boils down to this underlying issue of the need for political will. And I think that really feeds into a lot of things, and even stuff like health literacy. I think, especially from the work that I've done, the deficit of trust of the public in both the political system and the health system and in science has been, it's been brewing. And I think one of the things that all 3 speakers have really brought out really well is that COVID appears to really have heightened or highlighted our existing vulnerabilities. We were sort of doing well, but there were all these underlying vulnerabilities in our system that have just really come to the fore. And so now we're going to go into Q&A. We've got some really good questions, and I must warn some of the speakers, we've got some fairly straightforward, hard-hitting questions that have ranked very highly on Slido, and we're just going to ask them. So everybody else, please, get on the Slido link. Vote for the questions you like, ask the questions that you want, and I'm going to hand it back over to T for the first round of questions.
Okay, the first question I think is meant for the politicians on this panel, but I'm going to ask the question from 2 sides, one for the politicians and one Azrul point of view. What would you like the politicians to do? So the question goes like this: could you explain, when someone in the position that you're in as opposition, you can give such brilliant ideas, but when you get into power, the politicians seem to fail in delivering on their ideas and their promises. What is going on there? This is a question for Dr. Maszlee and YB Wong Chen. And I think to also explore the other side of the coin for Azrul is, from your point of view, what would you prefer politicians to do? I think part of your response talked a little bit about that, about transparency and being more guided by science. But could you get a little bit into the details of that, Azrul? Okay, back to the politicians on this panel. Dr. Maszlee and YB Wong Chen, who would like to go first?
Dr. Maszlee should go first. He was in the government, I wasn't.
You was not in the government?
No, I was in a backbench of the government complaining about my own government for 2 years.
Okay.
You better
Thank you very much. Okay, thank you very much, YB Wong Chen. I mean, yes, it's true. I mean, that's not only the case of Malaysia, but everywhere. I still remember the very classical example I had when I was in the UK, when the very first coalition of Lib Dem and Conservative came into power as a result of the 2010 general election. I still remember when Lib Dem, Nick Clegg then was the leader of Lib Dem, has promised before the election of the abolishment of tuition fee for higher education. But when they became part of the Lib Dem Conservative government, he cannot fulfill that promise, because, you know, when you have a coalition, you have to compromise of certain promises that you have made. You have to go to a certain ground to understand the situation. But anyway, that's not the case of that's not the only case of UK, but it's everywhere. And coming back to our experience, yes, I have to be honest to to the right, that we were trying to accomplish many of our promises that been stated in our Buku Harapan, but we were also similarly facing a lot of difficulties in fulfilling some of those promises, not all, but certain promises. But it's very unfortunate. The promises that we have fulfilled never been highlighted, but they always pick up on the things that we have not fulfilled yet. And it was not, it was unintentional. I mean, we try to put priorities, because normally when you were elected, you'll be given 5 years to accomplish or to fulfill your promises, because Rome was not built in a day. But again, expectations of people, of the stakeholders, of the voters, they thought that when they have voted you to power, so the very next day, they're expecting everything to be accomplished. We cannot do that, and I would admit that we were trying to do that, and we stretched our promises into 5 years, and we need to put the priorities. But time was not on our side. You know, only after 22 months we were in power. You know what happened, and it's very unfair to say that we did not accomplish. But you know, to worsen the situation, it was very unfortunate. On behalf of Kerajaan Pakatan Harapan, I would like to apologize. I mean, when the PM was boldly saying that all the manifesto is not a holy book, it was not Quran with stone. I mean, it's supposed not to be mentioned in such a manner. We have 5 years. We should try our best. We cannot say that if we fail to accomplish that within 5 years, then only we can come out saying that, okay, sorry guys, we've tried our best, but we did not manage to fulfill all of our promises. But on the very first year, you're saying that promises are not to be fulfilled because they're not holy book. And I don't think that's the right approach. And because I'm part of the government, of the cabinet, saya minta maaf lah kepada rakyat. I have to admit that we're supposed not to say that, and it has been said by the Prime Minister, but I don't feel that's the right way to deal with the matter. What, at my capacity as a Minister of Education, former Minister of Education, or as a Minister of Education, then we tried our best and we put priorities. We stretched our goal of the educational reform in 5 years, and some of them it's beyond 5 years. And coming back to Azrul's remark on the medical schools and the issue of contract doctors, I still remember, to blame the government is one thing, but another thing is about our community mentality. You know, we always thought that when you have a child, or we have children who scores straight A's or 9 A's, they should become medical doctors. It's very unfortunate. We are living in IR 4.0 generation, but we still have that type of mentality. If you read Yuval Noah Harari talking about 21 lessons on the 21st century, we should know that in the next 5 to 10 years, there are a lot of jobs waiting for us that does not exist at the moment. And we should look at those jobs of the future. And hence, we're mapping our higher education and our schooling system to move towards that. I still remember, I did establish what was coined then as the Big Data Committee of the Minister of Education, where I get the best brain from outside the ministry, from the industry, from Microsoft, from everywhere, to be part of it. And we did plan to come up with our own Big Data Committee using AI, using, just like Chen mentioned earlier on health, on economic. We tried to do that, and we engaged with the industry for TVET and for all these purposes in order to mapping the higher education and also our foundation education. We must anticipate what is going to, we must forecast what is going to happen to the job market for the next 10 to 20 years. So this is where the plan, but you know, the committee was abolished right after the government been hijacked by Perikatan Nasional, and they have no clue what to do, and they have no clue what they are doing at the moment. And I think whoever coming to the Ministry of Education with the new government or whatever government, they should put that in their agenda. I mean, the big data committee and inculcate artificial intelligence to forecast the job prospects, hence mapping our higher education and our foundation education.
Okay, let me answer some, at least from my perspective. I wasn't in the cabinet, right? So we're the backbenchers. I think when we won in May in 2018, we have to understand we inherited a budget that was proposed by Najib. So of course it will take at least 6 months to a year before we can carry out our own reforms in terms of fiscal spending, because you can have policies, and policies are roughly divided into political policies and then economic or actual spending policies. So actual spending policies, we had to wait for the 2019 period in order for us to table the 2020 budget. Yeah. So I understand where Maszlee is coming from in terms of they ran out of time in terms of spending reforms, But we didn't do any major spending reforms. We didn't do the tax system that required taxation issue. We didn't also focus on primary spending and how we spend, like having, no all open tender, reforming the circular on procurement. Those kind of things were not carried out. Because I was in the Public Accounts Committee, and when we had hearings, we found out, to my complete shock, that nothing has changed, So there were a lot of those grouses, and we were in the backbench were particularly unhappy because for the first 6 months, we decided just to keep quiet, let Mahathir do whatever he wants. And then increasingly, when we saw no political reforms coming through, then I think we got increasingly more angry. And then in the 2020 budget, which was Pakatan Harapan's only budget, we saw things that we were not happy with. The spending of certain money, using Petronas money to pay off tycoons for their GST and their income tax rebate. This was ridiculously high. So there were a lot of unhappiness at our level in the backbench. But I fully understand for Maszlee being the cabinet, they needed at least a year before they can work on the new budget, right? So you can't really judge Pakatan for May until May next year. That whole year was really about planning. But what was the big disappointment was the political reforms. Extremely slow. We were very happy about the asset declaration, but then once you go into the asset declaration itself, you find out that it's actually not really asset declaration, because you don't have to declare the asset of your wife or your children. You have to declare the asset of your children under 21. That's nonsensical, please. So there were a lot of things we nitpicked over these political reforms, and the broad, big political reforms were not carried out, I would say. So I don't think it's fair to say that every time you change a government that nothing gets done. I think the 2018 election will be remembered as a period where we did push and promise a lot, but under the leadership of Dr. Mahathir in particular, there was a lot of reasons why he didn't carry out those reforms. Partly political reforms, partly because he wanted people to jump to his party and strengthen Bersatu's position. So there are many factors there. So if anything, the public should know that you must continue to support whoever you think can deliver the best policies, but we hope that the future governments of Malaysia will actually carry out the policies and not just do lip service. And for that, we need members of parliament to be properly trained. We need the select committees to be fully functional and fully critical, so that select committees can become the basis for us on how to check government and also prepare ourselves to be future governments. So I think those things need to be done. Political reform was the first and foremost that we could have done, but we didn't do. As for fiscal reform and actual spending and changing all those, we didn't have time to do it, to be fair. Yeah? Okay, so that's my answer. Thank you.
Thank you so much. There's an underlying benefit of competitive democracy. Mr. Azrul, you want to respond to the other side of the question?
Sure. Speaking as someone who does not have Yang Berhormat in front of his name at the moment, I would like to just say that, we wish that there was more evidence-based policy making, and this is something that it rings true across the different governments. And I'm reminded of this very famous quote by Mario Cuomo, New York governor. I think it's quite famous. You campaign in poetry, but govern in prose. And for many a time, it seemed to be the case for most of the governments. And it's something that when we see the politicians themselves, especially those in government, there seemed to be a resistance towards looking at the evidence and more taking into consideration more of the political factors that come into play. And I think Wong Chen and Dr. Maszlee just now mentioned it quite significantly during their interventions just now. And it's important to also extend that Jadong label to also include some of those people on highest levels of government, and including politicians. But the thing is that governments have this tendency to kick the problem down the road, and hope that it's somebody else's problem. And sometimes we pay the price for that. And I think I give you a solid example, and this is mental health. It's been highlighted, earlier that mental health is something that needs to be invested in. We need to look at strengthening the infrastructure. And yet the amount that was allocated, this is of course before COVID-19, was pathetic. It was just a small amount that was just enough to pay the salaries of the individuals who are providing the care, and also to provide a certain amount of support for the people who are needing to be given the kind of subsidized mental health care for the general public. But the reality was that the investment was just not sufficient. And today we're paying the price for it, because we have COVID-19, we have all these lockdowns that we put into place, and it has created a mental health crisis amongst the people for which both COVID-19 they have to deal with, and also these restrictions. I'm sorry to say that today, this morning, somebody died by suicide in the place where I am staying in this morning. And that is where, if you want to see whether or not we have a crisis and the result of underinvestment in key areas of health, like mental health, we are paying the price for it right now, and it's being amplified due to the COVID-19 crisis. So I do wish that the politicians who are waiting today to become the government or are now in government would listen to the experts, the people who are in the education ministry, people in the finance ministry, the people who are in health, to listen to what they have to say and take into consideration the evidence before they make those policies. Thank you.
Yeah, thanks, Azrul. That's a great response. And so just a second round of question for everybody. And I think this really moves us from the political platform, where I think a lot of the rakyat or the public maybe feel that that there is little recourse, or that it has failed them, to maybe your thoughts on the role and the appropriateness of social media and netizens in how they've responded to and the different movements. And we're thinking particularly in relation to some of these main hashtags we've seen recently, such as hashtag Kerajaan Gagal, hashtag Lawan, hashtag Bendera Putih, hashtag Hartal Doctor. So from your own perspectives, and I would appreciate just a really short answer if you can, because we're almost at the end of it. What do you think about the use of these hashtags and social media movements, and the appropriateness of it in your sector or in response to these particular problems? So maybe we'll go in the order of how we started. If we can start with YB Wong Chen, followed by YB Maszlee, and then if Mr. Azrul, you can end it for us. So over to you.
Okay, let me just start. Social media, I use social media. I have about 60,000 followers on my Facebook, and then my officers who are much savvier and younger than me, they do the tweets. I have no idea how they perform on those or on Instagram. But I do feel that social media is a double-edged sword, right? You will, if you are not a very serious member of parliament on this kind of thing, and you focus primarily on social media, you are just essentially riding on populism, which can be quite dangerous, because every policy has costs and issues on costing. So we use social media. We are afraid of social media because it can turn against you, right? But I do not allow policy making to be influenced by social media demands, so to speak, right? We still look at data, we still look at numbers, we still try to do our best to balance the book, so to speak, and then do what is right. So social media, dicey issue. And I'm from a different generation. I think I'm older than Maszlee, right, brother? So
I'm only 25.
I'm 53 already. So it's a different thing which we're trying to cope with, so to speak. Okay, those are my views. Thank you.
Yeah, I totally agree with YB Wong Chen on that. But referring to all those hashtags by our youth, by our younger generation, I would say that we're in the road of democratic maturity, to be honest with you. The other day, a lot of people asking me when they saw my my Instagram picture of the book, how democracies died, and some of them, they asked me whether is democracy dead now in Malaysia. I told them no. We are on the way of maturity, to be honest, and let us not lose hope. And this type of hashtags are showing us that it's a sign of the light at the end of the tunnel. And never lose hope and keep striving. And for youth out there and for students out there, keep fighting. Yeah, Azrul.
Oh, okay. Well, I just want to say that when you look at what's happening today, when everybody's stuck at home, you're told to stay at home, you're told to basically not go out at all, and the usual stuff that we depend on for democratic participation in Malaysia, the rallies, the discussions, the meetings, we're deprived of that. And the next best thing that people have been able to do now, especially because necessity is the mother of invention, right? And that is to use social media. The power of social media now is an extension of that democratic participation and engagement. And right now, these hashtags, Twitter, Facebook, they're being used to mobilize communities that cannot be reached normally. But imagine somebody tweeting or putting out posts from Perlis is able to reach out to people in Sabah and to be able to get a response from that tweet or Facebook status. And it actually raises that level of participation and interest in the democratic space. But I totally agree with Wong Chen just now. It's a double-edged sword though, and you can see that Twitter space is very toxic. It's very poisonous. There's all kind of trolls there. It's a jungle. And you see different kind of people who are engaging on Facebook, different kind of people on Twitter, and then a different group on Instagram. I'm not really on Instagram yet. I don't understand that space, So when you look at it, really, it is something of evolution in Malaysia's democratic space. And just like Dr. Maszlee said just now, it's perhaps a symptom of the increasing maturity that is being expressed. Kalau dulu you wrote books, like a few volumes. Now you write, I don't know, was it 210 characters on a Twitter feed, and that's enough. I don't know. My yardstick is higher actually. But for a lot of people, this is it. This is how you engage with Gen X, Gen Y, Gen Y, Gen Z, the millennials. This is how it goes. But having said that, though, I have to say I'm a little bit distracted looking at my two panelists who seem to have black hair. I've got gray hair, and I'm technically the youngest in this panel. So anyway, back to you.
I started to losing my hair.
No, I agree with Azrul. The great fear about all this is the trivialization of policies through social media, right? Yes, you want quantity in the sense you want a lot of people, right? But you do want quality as well. You can't really narrow down a single policy to a hashtag or people understand it in more nuanced. It's much more complicated than that. Yeah.
Oh, thank you so much. I wish we had more time because there's still a lot of questions in Slido, but we don't have the time. But I just want to make sure I created the last 3 or 4 minutes for each one of you to put in your closing remarks. Specifically, if you could spend a sentence or two to answer this question, what would you say to Malaysian students, university students, about the future of this country? We'll start with Wong Chen, then Dr. Maszlee, and then Azrul.
Okay, for all the university students out there, and I do get a lot of interns, former interns and current interns. I always tell them the same thing. You know, you are the elite. You have an education. You're at University Malaya, which is a top tier university here, right? You have a duty to better the country, right? Things are complicated. It doesn't have to be political through becoming a member of parliament or come to Adun or anything like that. Please go out there, be a good citizen, be a taxpayer, vote, understand the issue, because you're leading the industries, the sectors that you go in, and you know, you must just learn always to be extremely critical of me, of Maszlee, of Azrul, everybody, because you need to develop a sense of what you are, and then only when you have a good sense of what you are and what you stand for, then only can you really contribute towards the betterment of the country. Okay, don't give up. Malaysian politics is very messy, but it's expected to be messy because we are multiracial and multi-party and multi-religious. It's just that how do we turn this, these challenges into real positive power for the country to go forward. Yeah. Okay. Thank you.
Okay, students out there, get yourself educated. Never stop learning. The life itself is a continuous learning process. Read a lot. And what I mean by reading is not your social media status and Facebook or IG or Twitter status, but I mean books. Read books, a lot of books, and always try to impart your knowledge to others as well. Try to educate others. Try to be what is called as Roshan Fikir by Ali Sharati, which means the enlightened intellects. You continuously educate yourself, learn, and you try to educate others as well. Never lose hope, continue to fight, and we fight together for a better Malaysia. Thank you.
I like to basically utilize a quote from one of my favorite political dramas, TV dramas, and West Wing. And that is, decisions are made by those who show up. So it's important that you don't exclude yourself. We need to be part of the solution to the many problems that we've discussed here today. You know, there are many puzzle pieces to the solutions, and where we need, honestly, we need the next generation of policymakers, decision makers, politicians who are dealing with the problems of today and not those of the 60s, 70s, and 80s living in the past. We need change. And it really starts with the people who see themselves as being those change agents. And I see that really in people like the two politicians that we have here with us right now, but also in the next generation, because we have to start thinking about who's going to replace these two guys, you know, and we need more people. We need more people to be engaged. So I would just change it a little bit. The messaging from our two YBs here is that be a politician like these two young Berhormats and see yourself be part of the driving reforms, you know. I'll just stay on the sides and be critical and, you know, take the easy way out. But you guys think about it, you know, be the change, you know, and we can see those changes happen together and not just depend on other people. Because if we don't show up, other people will, and they will decide for you on those changes. It will not likely be the stuff that you want to see. I end there. Thank you.
Thank you so much. I'll call you YB Azrul, Yang Berhikmat Azrul, right? YB Wong Chen, Dr. Maszlee, thank you for showing up. It means a lot for us, the university community, and we want to see you progress. We want to see the country progress. I'm glad all of you showed up, because I think a healthy democracy requires people to show up for the long-term progress. Thank you so much to all of you. Wong Chen, you want to say something? Yes.
No. Just thank you very much for inviting me.
All right.
we are in a crisis, but we do have to find time for this. Right, Maszlee?
Yes.
Thank you for
so
having
much.
us.
Appreciate it.
Thank you.
Thank you.
Thank you.